So the conduction of the heart begins in the right atrium with the SA node, also known as the sinoatrial node. The SA node is often referred to as the natural pacemaker of the heart because it initiates the action potentials that set the heart rate. The SA node generates impulses at a rate of 60 to 100 beats per minute. The main function of the SA node is to cause the right and left atria to contract. Once it contracts, the blood is going to be pushed through the tricuspid valve from the right atrium and through the bicuspid or mitral valve from the left atrium. Next, the SA node sends a signal to the atrioventricular node, also known as the AV node. The AV node generates action potentials at a slower rate of 40 to 60 beats per minute. Its main function is to introduce a delay to allow the ventricles to fill with blood. It also acts as a backup pacemaker if the SA node fails to propagate the initial action potential. From the AV node, the signal will then travel to the bundle of His. The bundle of His will then divide into right and left bundle branches. These branches send their signal through the interventricular septum all the way to the Purkinje fibers. The Purkinje fibers will then cause the ventricles to contract and allow blood to go through both semilunar valves. So the key takeaways that I want you to remember for the TEAS exam is that the SA node, AV node, bundle of His, and the Purkinje fibers are all autorhythmic. So autorhythmic means that they generate their own action potentials or electrical impulses without nervous input. I also want you to remember that depolarization means contraction and repolarization means relaxation. When it comes to the SA node, it's essential to remember that the SA node is often referred to as the natural pacemaker of the heart because it initiates the action potentials that set the heart rate. It's also important to know that the SA node is going to stimulate atrial contraction, which allows the blood to go through both AV valves, which is the tricuspid and mitral valve. The SA node also generates action potentials at a rate of 60 to 100 beats per minute. The SA node will then send a signal to the AV node, which delays the electrical signals so that the ventricles can fill with blood. The AV node also acts as a backup in case the SA node does not propagate the initial action potential. And finally, the AV node generates action potentials at a rate of 40 to 60 beats per minute, which is less than the SA node. So once the ventricles have been filled up with blood, the AV node will send its electrical signal to the bundle of His. The bundle of His will divide into left bundle branch and right bundle branch. These bundle branches will send their electrical impulses through the interventricular septum towards the Purkinje fibers. The Purkinje fibers will then depolarize the ventricles. By depolarizing the ventricles, this allows blood to go through both semilunar valves. So remember, we have the pulmonary valve in the right ventricle and the aortic valve in the left ventricle. Something also to note is that the Purkinje fiber generates an action potential of 20 to 40 beats per minute. This action potential allows the heart to keep beating in case all other nodes fail to propagate electrical impulses. Now that we have a basic understanding of the conduction system of the heart, let's talk about electrocardiograms, or ECGs. The electrocardiogram starts with the P wave. The P wave signifies atrial depolarization or atrial contraction. In other words, the P wave is going to signify the SA node. So remember, SA node is going to propagate atrial depolarization or atrial contraction. After the P wave, we have the QRS complex. The QRS complex signifies ventricular depolarization or ventricular contraction. The QRS represents the Purkinje fibers since there is ventricle depolarization. Also, the delay that's occurring between the end of the P wave and the beginning of the QRS complex, that's going to represent the AV node. After the QRS complex, we have the T wave. The T wave signifies ventricular repolarization or ventricular relaxation. You might also see a wave after the T wave. This wave is called the U wave, and it just signifies further repolarization of the ventricles. In the TEAS, they might also ask you about ECG intervals and segments. The first interval we'll be discussing is the PR interval. The PR interval is basically the period from the beginning of atrial contraction to the beginning of ventricular contraction. Next, we have the ST segment. The ST segment represents the period when the ventricles are completely depolarized. And finally, the QT interval. The QT interval represents the entire action potential. So it's going to include both the ventricular depolarization and the ventricular repolarization. Now, we will be discussing systolic and diastolic pressure. For the TEAS exam, the only things that I want you to know is that systolic pressure is the measurement in millimeters of mercury of the pressure exerted during ventricular contraction. It's going to be the number found at the top of the blood pressure reading. Diastolic pressure, on the other hand, is the period in which the ventricles relax and the blood pressure is at its lowest point. The normal average blood pressure for an adult at rest is 120 over 80 millimeters of mercury. The 120 indicates systolic, while the 80 indicates diastolic.